Hello and welcome to National Focus for Tuesday, August 13, 2024. I am Aaliyah Martin. In the headlines, an appeal to the public to stop vandalism at DCFH. Dominica launches mission to enhance healthcare access. And Axom achieves remarkable growth in its first year of operation. The details of the headline stories and more when we return.
Ride safe, wear a helmet, safer roads in the nature aisle. This message was brought to you by the government of the Commonwealth of Dominica.
Welcome back. The management of the Dominica China Friendship Hospital has recorded several incidences of vandalism on the hospital's premises and is deeply concerned about this dangerous trend. Over the past several months, the hospital has encountered numerous challenges due to the destruction of hospital property, including safety and emergency equipment.
The management of the Dominica Hospitals Authority is very concerned about the blatant act of vandalism on the hospital compound, where perpetrators have destroyed the sign that is affixed on the hospital. So individuals, emergency responders, as well as visitors can have easy access to the hospital. The signage was placed there to give the hospital identity.
The sign is, of course, the sign for the hospital, which has been totally damaged and vandalized. And of course, this is the second time this is happening. They are totally removed from the sign itself. Of course, we really want to call on the public to desist from doing such acts. We are working collaboratively with the police and, of course, with the courts by extension. And whenever somebody saw someone dealing with this or committing such acts, then of course we would like them to report it immediately, so that we can take the necessary action to ensure that it doesn't happen.
The emergency telephones in the elevators have been maliciously destroyed, in some cases completely ripped from the elevator walls.
So these telephones are installed in each of the elevators that we have on this facility, and they are so very essential for allowing an individual to call somebody outside in case there's a malfunction in the elevator or other emergency. So the handset itself has been removed, and of course, if there's an emergency situation, there's no way that they can call somebody outside to assist them quickly. Yes. Also, the cameras, in the event of an emergency within the elevator, we will not be able to see one who is inside, and of course, the time that it takes to call somebody from outside to come to provide the necessary assistance from within.
Mr. Frederick is appealing to the public to desist from tampering with vital equipment at the hospital.
Imagine a patient is being taken to the operating theater or even ICU, and there's a malfunction with that sick person within the elevator, and we are not able to see or call via the telephone. The time that it takes is maybe so critical that it may involve the life or death of that person coming from the A&E. So we want to take this opportunity to encourage persons to cease and desist from tampering with the cameras on the facility, because it interferes with everything else, the safety and security of the patients, the visitors, the staff generally. And we really want persons to understand why we are doing all this right now, so that therefore we can have a safe environment for everyone coming to the facility.
The management and staff of the Dominica Hospitals Authority is soliciting the full cooperation of the public ensuring due respect to the equipment within the facility.
They take our flash drives, the toilet seats are destroyed, the doors, the toilet bowl cleaners, even the toilet paper holders, everything is either destroyed, removed, or taken by perpetrators. We do not know who they are.
If you just look at the back, you will see the monitors with the flash drive attached to it. These flash drives are being taken away as well, among others. And of course, the purpose for the flash drives is to ensure that important information is displayed on the monitors for the guidance of our patrons here. Taking them away, it really doesn't help. And of course, we again ask people to stop doing those things.
The CEO says when such things occur, funds that were earmarked for other critical hospital operations have to be reallocated to fix the problem.
We have to reallocate our scarce resources for us to ensure that the signage is maintained at all times, and all other areas where the acts of vandalism happened, we have to rectify it. So our resources we have to reallocate to take care of the problem. So it really puts a strain on our finances, and as you're aware, the upkeep and maintenance of this place is very costly, and I want to thank the staff for the good job that they are doing to make sure that this facility, as you can see, is maintained and kept well for everyone when they come to access services at the hospital.
The hospital assures that the Safety and Security Department is working very closely with the police to investigate these incidents and bring the perpetrators to justice. Anyone with information relating to acts of vandalism at the hospital can contact the Security Department at the Dominica China Friendship Hospital at 266-2135 or the nearest police station. In a first of its kind for the region, the Ministry of Health, Wellness and Social Services, in collaboration with the Pan-American Health Organization, PAHO, is launching a 5-day mission aimed at educating health workers about their vital role in achieving universal health coverage and access to healthcare services. This effort also focuses on ensuring accessibility to pharmaceutical products and services through a robust pharmaceutical supply chain system.
The Ministry of Health, Wellness and Social Services places significant priority in this area. In an effort to ensure the optimal health and wellness of the population of Dominica, this government is committed to ensuring that there is a robust supply chain management system that guarantees adequate procurement, distribution, and financing of pharmaceuticals, and that they are maintained. The recently debated $81.9 million recurrent expenditure and $7.5 million capital budget for health in 2024-2025 cited the development of a better system to manage the procurement and distribution of medical supplies as one strategy to improve patient outcomes.
Access to medicines is a fundamental component of any pharmaceutical policy and a key priority of public health policy. Ensuring access to essential medicines and health technologies, including vaccine and biologics, requires the establishment of a well-organized system that integrates selection, financing, demand forecasting, procurement, storage, distribution, and the rational use of pharmaceuticals, all tailored to meet the needs of the population.
Our roadmap for the further development of the SCM system comes after the offer of an invitation by the Ministry of Health, Wellness and Social Services to the OECS PPS to conduct an assessment here in Dominica. Over the last several months, this entity was able to identify gaps in the operations of CMS, or Central Medical Stores, including but not limited to poor supplies forecasting, financial constraints, human resource constraints, poor inventory and warehouse management. As we continue to work in the implementation of recommendations made we must note our successes, including the recent implementation of a logistics management information system and the development and pending passage of the pharmacy bill.
The vision behind the American-Canadian School of Medicine, ACSOM, is coming to fruition as the school has experienced remarkable growth since its inception last August. Recently, ACSOM hosted its third white coat ceremony, with even more students expected for the next academic year. Although a significant number of applications are submitted throughout the year, the school ensures that each application undergoes a thorough vetting process to uphold its high educational standards. Founder and board chair of ACSOM, Dr. Arvind Bhagapur, stated that this progress would not have been possible without the commitment and support of the government of Dominica, as well as the faculty and staff. Dr. Bhagapur himself studied at Ross University, which is located in the same building as ACSOM from 2005 to 2009.
We've come together to create really a unique and phenomenal education for you that's bespoke and will lead you down a path of becoming a healer, passing your boards, and achieving all your dreams. So I know the path's not easy. I've taken the USMLEs, struggled, had my hard time, had to learn new things as I entered into residency that wasn't relevant anymore. Things changed. Had to learn many more drugs than probably Dr. Amati had to learn at his time. Parkinson's, maybe had 4 or 5 drugs at the time when I was graduating. Now there's maybe 10 drugs that you have to know the mechanism of action for, how it works, side effects, etc. So I understand that the path that you're going through is even more difficult than one that I traveled.
The global health crisis, such as the COVID-19 pandemic, have dramatically changed how people perceive healthcare workers. As a result, there is a significant demand for professionals in this field. Dr. Bhagapur encourages aspiring physicians to remain steadfast in pursuit of their dreams.
Sometimes polarizing, sometimes great challenges in front of us. So don't give up, work hard, and you can walk the paths that so many more have walked besides just me through these very doors at the prior institution.
He reminds the students that becoming a doctor is no easy task. It demands resilience, dedication, and a profound commitment to helping others.
It also offers a chance to make a real difference, to touch lives, relieve suffering, and contribute to the well-being of society. Here at the American-Canadian School of Medicine, we are not just your educators, we're your partners, your mentors, and your family. We see the promise in your future and are committed in helping you realize it. We're the first and only nonprofit private medical school in the Caribbean. Our goal is to keep your student loan debt as low as possible while providing you the highest quality education and leading you to great success as a clinician. We see the promise in your future and are committed in helping you realize it. Remember, your journey doesn't stop at the walls of this school. What you learn here, the relationships you build, and the experience you have will carry you far and beyond.
Dominica continues to produce exceptional leaders in the healthcare profession.
The Commonwealth of Dominica has produced more than 20,000 physicians who are now practicing in the United States and Canada. You are part of a proud tradition that reaches across borders and culture. Medicine is the bridge that connects us all. Tonight we celebrate your achievements, and we also honor those who have supported you. The government of Dominica, thank you for your strong support and vision. To the families here, your love and sacrifices have made this moment possible. To our benefactors, thank you. And to our students, remember, you are part of a community that believes in your dreams.
You're watching National Focus. More when we return. Welcome back. The Dominica Football Association is pleased to announce participation in the Caribbean Football Union's Boys Under 14 Challenge Series, scheduled to begin August 16 to 25 in Trinidad. Dominica Boys Under 14 will compete in Tier 2, Group B of the 3-division event. The Dominica team will come up against the British Virgin Islands, BVI, Turks and Caicos Islands, and the U.S. Virgin Islands in Group B of Tier 2. Dominica team will begin its campaign on Saturday, August 17 against the U.S. Virgin Islands, to be followed by the Turks and Caicos Islands on Sunday, August 18, Anguilla on Monday, August 19, and British Virgin Islands on Tuesday, August 20. Asaf Banis is captain of the Under-14 boys football team. He says the squad is ready to represent Dominica on the big stage. The team consists of Asaf Banis, Javon Hamilton, Tishon Christmas, Taran George, Shequan Gustav, Roxanne Coppel, Peter Greenaway Jr., Mario T.J. Lewis, Lamari Frederick, Kian Buchanan, Kelano Williams, J.N. Thomas, J.N. Lockhart, J. Swanee Blaise, Elon Pascal, Edric Augustine, Daniel Christian, Dane Ambo, Che Etienne, and Khalik Prevost. We at the Government Information Service wishes the Under-14 team the very best during the tournament. The Dominica State College has hosted its inaugural summer camp focused on the 4 pillars: agriculture, culture, tourism, and science. Titled Ask the Camp concluded on Friday, August 9th, with participants being celebrated for their various achievements throughout the camp. The campers also showcased their creations from their time at the college, highlighting their experiences and learning during the program.
Featured speaker Mrs. Coralie Thomas highlighted the importance of the participation the students had at the camp and the activities that they engaged in, as well as the learning which was achieved during the camp. She focused on the importance of healthy eating and nutrition, which was one of her sessions that she facilitated during the camp as a nutritionist. There were several other facilitators for the camp, and they were all recognized at the closing ceremony. A few notable facilitators were Honorable Lakia Joseph and Mrs. Coralie Thomas for Agriculture, Mrs. Delia Coffee Weeks, Derek Peters, Tasha Peltier and the Cultural Division, and Asperias Quayol DBS with Kiwana Fontaine Wilson and Jamasha Mello for Culture, Julian Benjamin, Kerwin Lloyd, and Marissa Sabruch Jules for Tourism, and Janelle Brisbane, Verone Nicholas, and Melissa Richards for Science.
The children had a very engaging and memorable experience this summer, where they enhanced their skills across each of the 4 pillars. Activities included vegetable planting, belly dancing and drumming, workshops and experiments, along with the much-anticipated Friday field trips.
During the closing ceremony, campers were allowed to give their reflections on the camp experience, and Omar Grell showcased what he had learned at the camp during this period. The sponsors and various partners of the camp, including JCI Dominica, were all recognized at the closing ceremony. Of notable mention were Mr. Walter Greenaway, who was recognized for his contribution in gaining sponsorship for the camp, and Mr. Naren Murthy, who was recognized for his promotional effort of the camp. The DSC staff and the ACTS Summer Camp Organizing Committee were also recognized for their involvement and work.
The Dominica State College aims to continue hosting the ACTS Summer Camp in the coming years, as this summer's program was deemed a great success. A total of 33 students aged 6 to 15 participated in the camp, and there is anticipation for increased buying and engagement in the future. The focus will remain on enhancing the 4 developmental pillars, which are crucial to the mission. Coming up next, the Creole News Highlight with Jeno Jacob.
Bienvenue sur Nouvelle en Créole, non, Monsieur Jeno Jacob. Ceremony White Coat American School of Medicine, ASCOM, l'école médecin l'Amérique, tient 3e Ceremony White Coat mois Salah. Cérémonie en pour place vendredi en Guantans. C'est docteur qui finit l'école médicale, yo ça c'est en 1928. Gouvernement a supporté American School of Medicine depuis yo commencé. Chef officier académique Dr. Ramin Amadi remercie le gouvernement Dominique. L'école là qui ni première graduation en 2127, autant étudiants 9 qui rentré en l'école 9 Salah. High Commissioner 9 Horde Republic India, His Excellency Dr. Pradip Singh Rajpurohit, Horde India, présenté document par président Dominique Excellency Sylvanie Burton. Cérémonie en place en State House là. Président Dominique dit relations diplomatiques et puis India qui continue et puis produit fruits. Il remercie India pour support en développement Dominique, support en initiative Energy. Dominicien, ça allait India sans visa pour 90 jours. Dominique une relation diplomatique et puis India depuis 1981. Management l'hôpital Dominique China Friendship par information contre incident moun qui vandalisé l'hôpital là. Combien mois à présent, moun qui détruit équipement en l'hôpital. Ça pas bon pour nous pièces et pas bon pour le développement Dominique. C'est équipement qui a coûté Dominique et coûté gouvernement autant l'argent. Aussi docteur et puis nurse besoin d'équipement ça là pour sauver la vie moun qui malade. Ou pour dire qui moun détruit et puis washer téléphone en ces élévateurs. Management l'hôpital Dominique China Friendship commandé public là pour arrêter négative action ça là. Dominique c'est pays nous toutes développer Dominique et puis arrêter action ça là. Ça c'est tout à ce nouvel en créole, changez-nous en temps cyclone, vos documents en plastique pour préserver votre la pluie et puis boire autant rasé chaud, ça c'est rasé qu'on bois d'aine et puis citronnelle pour fouiller et puis pour l'awim, couper branche bois qui panne pour caillou et puis ça bien important en temps cyclone ça là. Ça c'est tout à ce nouvel en créole. Non, c'est Geno Jacob. Au revoir.
And that was Jenna with the Creole News highlight. Now your weather advisory. On the forecast track, Tropical Storm Ernesto is expected to continue to move across portions of the northern Lesser Antilles today. Tropical Storm Ernesto is expected to result in overcast skies with showers, which could be moderate to heavy at times, and thunderstorms. A flood warning remained in effect until 6 p.m. today. The public is advised to continue to be vigilant and to exercise extreme caution. Interests in Dominica and the Northern Lesser Antilles should continue to monitor the progress of this system, and preparations to help save lives and properties should be in place. Moderate to rough seas can be expected in open water with waves peaking near 10 feet in open water are possible today. A small craft warning is now in effect for above normal seas. Small craft operators and sea bathers are advised to stay out of the water. As we are in the midst of the hurricane season, one must take precautionary measures to safeguard their life, property, and the safety and security of loved ones. For today's hurricane tip: if a flood watch or warning is issued, evacuate to higher ground immediately if you live in areas prone to flooding. And that's all for this edition of National Focus. Be sure to follow GIS Dominica on Facebook, YouTube, and on Twitter. You can also drop us an email at gis@dominica.gov.dm. From all of us here on the GIS News production team, I am Aaliyah Martin. Thank you for watching and stay safe.